take these out.
No, don't give
Okay.
away your secrets.
Are we filming?
Yes.
Alrighty. So we just treated her, and think of a bottle of champagne standing on the table.
Want me to film you?
No, just think of a bottle of champagne. You want that cork to go towards the ceiling. What we first treated your torsion. We'll demonstrate that in a while. And then we treated your pubic fibrocartilage, and just like that champagne cork going towards the ceiling, we did a slow release over the course of 3 minutes of moving that fibrocartilage forward using the ischium as contacts. And so now I'm going to palpate and locate the pubic bones, and I'm going to first spring the right pubic bone. The face of the pube, we're going in a posterior direction. So I take up the slack and I spring it. Do you feel that recoil?
Mm-hmm.
Okay. And I'm going to walk over. I'm on fibrocartilage. Now I'm crossing over onto bone. I'm on the left pubic bone. I'm taking up the slack. And do you feel that this has more movement?
Mm-hmm.
Okay. Now, so they're both moving. Do they feel somewhat symmetrical?
More symmetrical than before.
Okay,
Yeah.
more symmetrical than before. Now I'm on the fibrocartilage, and now I'm taking up the slack, and to me it feels like it doesn't move as much as before. Your thoughts?
I think that may be true.
You think that may be true.
It's still tender, but the translation is different.
The translation of that structure is different. How so?
It doesn't seem to be translating as much.
Doesn't seem to
It
translate
felt
as much.
when you, at the end of the technique, it felt good, like a relaxing.
At the end of the treatment technique.
At the end. Mm-hmm.
Very good. Alrighty. Well, let's have you sit up and we'll look at the sacrum again. So your left lower quadrant of the sacrum was prominent and stuck. And so here's PSIS's. So that makes this S2. So left lower quadrant would be right there. I have a pisiform contact and I thrust. It's an abrupt thrust, or you can take up the slack. Before we couldn't even take up the slack, and now you can see that there is force transmission. How does it feel to you?
Feels like it moves.
Yeah, so it now moves. So we corrected the torsion of the sacrum, okay, which left lower quadrant was prominent and stuck, and we improved movement in each pubic bone in a posterior direction. Those movements are more symmetrical, and the fibrocartilage doesn't feel like it moves as much as before. Now the amount of excursion in each pubic bone I still would describe as being hypermobile to a degree. So we will encourage you to use a trochanter belt. It's worn at the level of the pubic joint. And good research shows us that creates 40% more compression, not only in the pubic joints, but also in the sacroiliac joints. So it's actually worn lower than a sacroiliac support. So I think that will help that firm up over the course of 6 weeks. Maybe longer, but I think within 6 weeks, I think it's going to be a lot more solid, and certainly strengthening the pelvic floor makes sense. Generalized strengthening makes sense. And I think I've talked enough. Do you have anything else to add?
I think the only thing I have to add is at this point, since I'm still nursing and the relaxing still in my body, that might be why it's more hypermobile still.
Very good. Can you say that one more time, just louder? I don't know how much pickup that camera has.
So I still have relaxin in my body because I'm still nursing my younger daughter.
So you have that hormone that makes the pelvis a little bit loose.
Yeah, so I think that's why it might be still more hypermobile.
Yeah. And you'll finish nursing when?
In a while.
In a while. It'll be a little while.
It will be a while.
She's a young one. Okay. Alrighty. So let's just keep filming, and we don't need to follow her. Let's just have you walk down towards Carolyn and back and tell us how you feel, and we'll wrap up. And I don't know that you're going to feel any different, but thought I'd at least ask.
Well, I think just sitting up from the chair, it just feels more freer. I think just in general, not anything specific.
Uh-huh.
But
Very good.
Certain things just feel more relaxed. Because
All right.
I just feel kind of sitting in a chair for a bit, it feels really stiff for some reason.
What is it?
Just the whole thing, all of it.
The whole.
Pelvis, lumbar spine, all of it. It just starts to feel stiff, like I need to move. That's the stiffness, so it feels better.
Very good.
Yeah.
Well, we'll stop filming now. I sure thank you.